Thanks for joining us today. My name is Jody Archer, and today on Ask the Doc, we have with us Dr. Andolina. Dr. Andolina is one of our plastic surgeons here at King's Daughters, and in our plastic surgery office, we offer walk-in Wednesdays for Botox and filler Fridays for facial fillers. So one of the most commonly asked questions we receive on our King's Daughters Plastic Surgery Facebook page is, what is the difference between Botox and facial fillers?
So the major difference between Botox and facial fillers is what they actually are. So Botox is it's a paralytic, or I guess a neuromuscular blocker. And what that really means is it stops the muscles from contracting. It's actually made or derived from a toxin from a bacteria that they purify, and it's actually very safe to use. And like I said, what it does is you inject it into certain muscle groups, and that stops them from contracting, and it stops furrowing and wrinkling from happening. And fillers, on the other hand, are exactly what they kind of sound like. They are fillers. They're used to augment and give volume to certain areas, and also to get rid of some mild to moderate wrinkles. And what they're usually made up of, or the most common ones, the most popular ones, are made up of hyaluronic acid. And that's a compound that's normally found in the body, but they now have found a way to synthesize them and make them synthetically, and that's what fillers are. There's different types of fillers too, but those are the most common ones.
Okay. So where would you typically put Botox, and where would you put fillers in the face?
So in the face, the most common areas for Botox are in the forehead, in the kind of eyebrow line, the crow's feet or the smile lines around the eyes, the bunny lines by the nose. Some people do them around the lips also, and those are the major areas to do them. And fillers, on the other hand, fillers are a little bit wider in terms of where you can put them. Some people, like I said, use them to actually fill wrinkles and lines, so in the forehead, around the lips. Those are kind of big areas. These kind of smile lines, the nasolabial lines, marionette lines around lips here, and actually in the lips themselves to augment them, and also in the cheeks, also to augment those, and as well as in the lids, upper and lower lids. So put them in there.
And last but not least, are they painful?
So Botox is not. From all my experience doing it, the patients actually say it's very well tolerated. It's not very painful at all. It's actually some people get a little nervous about it, but afterwards, like, this is nothing. I would definitely do it again. Fillers, on the other hand, can be a little painful and uncomfortable. But what we do is we normally offer two different ways to kind of reduce the pain. The first would be a numbing cream that we put on. You're just going to put it on for about 15 to 30 minutes before the procedure is done, and just kind of let it set in, and that kind of takes some of the edge off. And then the other option that we have is actually to do a nerve block, where we actually inject some lidocaine in the areas that we're going to inject, to kind of knock out the nerves for a little while so it's painless. And actually the product itself that we use here is Restylane, and actually Restylane L, and the L stands for lidocaine. So the product has some lidocaine in it, so as you inject, the pain gets less and less.
That's good news.
Yeah.
Well, thank you, Dr. Andolina, for joining us.
You're very welcome. Thank you.
Thank you so much for joining us today on Ask the Doc.